The first thing is, if you don't know me, I'm Josh. I'm one of the vets at North Scottsdale. We did want to take time and sort of talk about really the facts and the things that we know with respect to this condition that's obviously being picked up and sort of described by the media and what seems to be myth at the moment. But I thought before we even get to that, I want to just point out a few things so everybody's on the same page. Traditionally, when we talk about infectious respiratory diseases, the things that dogs are more likely apt to get from other dogs, we talk about something called kennel cough, otherwise known as Bordetella, which is caused by both a virus and a bacteria. And like the name suggests, it's something that a dog may be stressed, goes into a strange environment and gets exposed to, but really, oftentimes it's the stress of being in this unfamiliar environment, which sort of lessens their immune response or protective immune response and allows it to sort of get a foothold and cause what we typically think of as like a lot of coughing, sneezing, some of the obviously more common symptoms of
I'll take this over. Can you put the towel?
I'm sorry? Oh, I guess that wasn't for me. And then, of course, there's another upper respiratory disease that we hear about sometimes. Admittedly, we don't see it nearly as much, but we do sometimes talk about the canine flu. We don't really vaccinate it for here. We see more of that in the Midwest. Admittedly, dogs who come down with the canine flu or influenza and dogs that come down with kennel cough or Bordetella can oftentimes look quite similar in terms of their presentation. And in fact, the treatment that we use is admittedly very simple. It's similar in that it tends to be supportive. And by that, I mean, we want to make sure they're eating and drinking. If necessary, we manage some of these cases with things like cough suppressants in. When we suspect or see evidence of a bacterial component, we will then oftentimes start them with antibiotics as well. And for most dogs who are, let's say, long-nosed dogs who are otherwise pretty healthy, we can expect a course of roughly 10 to 14 days when they're down and out and they're experiencing the effects of this particular condition. Especially if they're vaccinated, they tend to work their way through it without too much difficulty. I suppose you could say that the exceptions, in particular, are dogs that tend to have smushed faces. And with your sort of classic form of kennel cough, it's those smushed face dogs that, because of their anatomy, are a little bit more at risk for developing things like pneumonia. But that tends to really not be the case with longer nosed dogs. And of course, both with kennel cough and influenza, we have effective vaccines against them. And if you're accustomed to bringing your dog to a boarding facility, daycare facility, even groomer, they almost always require a Bordetella vaccine. What we're dealing with now, and I'm going to say this, there's a lot more questions than answers at the moment. And I'm going to say, first and foremost, that despite what you hear in the news about this sudden sort of outbreak in a variety of states, the truth is we had this very same thing happen this time last year here in Scottsdale and Phoenix. It was actually something we brought to the attention of the state veterinarian. There was a brief news story that a local daycare boarding facility had to be shut down and sanitized. And I will tell you that we did see a number of seriously ill dogs. Dogs, in some cases, we were unable to save. We saw those dogs that we did treat successfully required very aggressive therapy. And as an example, in the span of just a couple of months at the end of last year, we saw somewhere in the neighborhood of 12 to 15 difficult cases of bacterial pneumonia. That is an exceedingly high number for us, for one hospital. And I can tell you that there were other clinics in the area that were seeing the same, were having the same experience. So while it didn't make national headlines, it is something that we've sort of been through once before. And what was interesting back then is the fact that all of these dogs had been at a daycare or boarding facility. There was no one single facility that was responsible. They were all vaccinated against Bordetella. Some were vaccinated against influenza. And as is the case now, many of those dogs, we actually tested for a variety of other pathogens or viruses and bacteria to try to identify what was causing the issue. And we didn't identify anything. And that's sort of the situation we're in now. The biggest question right now is that what we're experiencing, is it due to some sort of unknown virus or a variant of a known virus, like a variant of this, for instance, the parainfluenza virus, which causes kennel cough? Or are we dealing with a bacterial infection? Again, one that we haven't yet identified, or one that's perhaps resistant, or I guess you could even say mutated in some way and no longer responsive to some of the more traditional therapies. And in fact, just like with classic kennel cough, you could actually have an interaction between both. You could have a viral component and a bacterial component, and those two could sort of play off each other. As it stands right now, there are a number of centers around the country that are doing tests, including here in Arizona, to try to isolate and identify an organism that could be responsible. Thus far, somebody who may have read stories that there is some suspicion, although it hasn't been confirmed, that there is a bacterial organism, a form of what's called mycoplasma that could be playing a role. That's preliminary. The only thing I'll say about that is, anecdotally, that would at least be consistent with our experience in that those dogs that were seriously ill did respond to the use of a particular specialized antibiotic to which the mycoplasma is sensitive. But there has a lot more testing to do. Thus far, standard testing we do for about 10 or 12 different upper respiratory pathogens in many of these dogs is perfectly normal.
Can I just ask a quick question about that?
Sure.
So are the testing that you're doing, is it PCR testing? Because my understanding is that the PCR testing would pick up mycoplasma, right?
That is correct.
So
it is both PCR testing. While we screen for mycoplasma, and as is the case with a lot of PCR testing, unfortunately, at least in veterinary medicine at the moment, it's not as accurate or specific as it could be. In fact, in order to enroll in the study that the state of Arizona is trying to conduct, we need to perform a variety of tests, including these PCR panels, and find out these dogs are completely negative, and then submit a whole variety of samples in an attempt to culture something like mycoplasma, which is a difficult organism to identify at times. But yes,
so the question is, are they treating it with like a macrolide then, which would, what are they treating it with that they're seeing a response?
The drug that we have the most success with, and I know others have had more success with, is a drug called chloramphenicol.
Oh, okay.
It's no longer a drug used in human medicine because of certain serious side effects, but it is still one we use on occasion in veterinary medicine.
Okay.
And admittedly, those dogs last year that were treated successfully had to be on multiple antibiotics in order to resolve the infection. Again, it doesn't eliminate the possibility of a viral component. And that's unfortunately very frustrating because none of us know at the moment what we're dealing with. The latest news out of veterinary schools like Colorado State and Cornell is they're continuing to make attempts, but they still don't, as of today, have a good idea what they're going to find. And which leads me sort of to this next sort of section, and that is, what do you do as a pet owner? What can you do? What do you look for? The biggest challenge here from a pet owner's perspective is going to be the fact that initially the clinical signs of things like kennel cough, even flu, and the more serious respiratory disease we're talking about are all going to look about the same. You may have a dog that develops a cough, they become a little lethargic, perhaps they don't want to eat, they might have a fever, maybe even just a low-grade fever. So those symptoms are not specific for any one particular disease complex. So what do you do? Well, first and foremost, to be fair, you do want to make sure your pet is vaccinated. You'd rather at this point not put them at risk for something simple like Bordetella or influenza if you can avoid it. And admittedly, both of those vaccines are extraordinarily effective at preventing those conditions, or at least be more correct to say at minimizing the impact and lessening the severity of the disease, like any vaccine would. If you can avoid exposing your pet to unfamiliar dogs in an unfamiliar environment, that is going to be advantageous. If you have a dog who is used to living at home, who gets put into an environment with 10 other dogs or around strange people, that causes a lot of stress. And in those types of environments, it can predispose that pet to acquiring something like this as yet unnamed respiratory pathogen.
Can I ask another question just in terms of transmission? So do they believe that it's droplet based, meaning close contact versus
Yes.
airborne?
Yes.
Okay.
Right now, there's no evidence or significant case reports that if you have a dog that has the disease and they say sneeze on a table, that another dog could come along and sort of lick or smell that. Now, again, we don't know for sure, but if we look at most of the other common respiratory pathogens, they really don't survive in the environment too well.
So just a question then specifically, because I have a dog that is in dog sports agility. So like, for instance, in the facility, they've heightened their things now where they're allowing no nose to nose contact. Dogs have to be kenneled when it's not their turn, and the kennels are being wiped out with like a Viricon or you know, in between dogs. Like, I know that that's not perfect, but based, if it's droplet based, would that be a reasonable thing if you're still kind of doing those, you know, engaging those activities?
Yes, I would consider that reasonable. Like I said, the primary means of transmission is thought to be direct dog to dog contact.
Josh,
Yeah, I'm
I
sorry,
have a
Lily.
question. What about when I bring Spicy to Dr. Fork, and in that facility it's gonna be next week, and always we need to wait for her, and they always have 3 or 4 dogs, and it's a small room. So
Right.
what I should do, because Spicy cannot get vaccination because he's
Right.
cancer thing. So
on one hand, I think it's fair to say that all the clinics now are taking very careful measures to make sure that transmission from, let's say, an object, a table or chair, is not going to be something that we need to consider. So the sanitation procedures, even if a place like you referenced, I don't have any reason to be concerned about those. But like in the case you described, honestly, I would keep him in your vehicle and let the front staff know, hey, we're going to hang out in the car. When you're ready for us to put us in a room, you know, separate from any other patients, we're ready to go.
okay.
But if you want to minimize the chance he's going to be around other sick animals that could pass something on because he isn't vaccinated, I think that makes the most sense.
Okay, thank you.
So Josh, this is Lisa.
Yeah.
Is there any concern at all about pet sitters who have been around other dogs being in your home? Is there any concern about that?
So I haven't seen any case reports to that effect. And while that's possible, again, most of the more common organisms we deal with, although again, we don't know what this sort of unknown looks like, they don't really survive on tables or clothing all that well. I think if there's any concerns, I think if you have somebody come in, just tell them to change their clothing. I think there's nothing wrong with that. But I think it's unlikely that that's going to be a, you know, effective means of transmitting it.
Okay, thanks.
I have another question, Josh. What about, I live in a community, it's a small community, and everybody have dogs, and we walk the dogs in the morning. So if the other dog is sick and sniff or pee or something, and they sniff around, is no any risk of
No, to the best of our knowledge, this is something that's transmitted through respiratory secretions, not urine or stool. So I wouldn't be as concerned about it. There are plenty of other things they can get from urine or stool. This doesn't seem to be one of them. Any other questions? I'm sorry, to that point. No. Okay. So getting back, so you know, the initial symptoms are not distinct. They're not unique. There's no one symptom that I can point to and say, aha, if you see this, this is an immediate cause for alarm or concern. Some of the, I'm not going to say defining features, but some of the more common features of this syndrome that we're seeing are, number one, unlike classic kennel cough, which usually has an incubation period anywhere from about 7 to 14 days. These dogs go from being normal to coughing to be seriously ill within just a couple of days. And I can say that not only is that reported, but we've seen that. Last year, that's the exact pattern that all of the sick dogs we dealt with manifested. So really within 1 to 3 days, these dogs go from being normal to seriously ill. Now, in those dogs that are able to, that we identify early, that we treat successfully, unlike, again, kennel cough, which for most pets usually resolves within, let's say, roughly 2 weeks, some of these dogs take months to have the cough resolve. And I'll just say on that point, as far as treating them, At the moment, there's not a defined protocol for how long we actually treat these patients, either with antibiotics or other, supportive care measures. So we're using our best judgment, and oftentimes we're treating them past the point that their symptoms resolve, or when there's just very, very clear evidence that they're on an uphill trajectory, and their blood work looks good, they're not having any underlying clinical signs that indicate illness, and they're able to get back to their normal routine. But as you can imagine, we're also still showing owners, hey, you need to restrict this dog's access to other pets to minimize the possibility of transmission. The other thing is that, much like what we see when we have a case of kennel cough in a smushed-faced dog, if you have a smushed-faced dog, if you have a dog that has an underlying respiratory disease, or you have a dog that has a condition that may adversely affect its immune system or essentially cause its immune system to be a little less vigilant, those are going to be patients that are more susceptible. And those are patients that you want to isolate and segregate from other, especially strange dogs, to minimize the risk of exposure. Even in a perfectly normal situation, when we have a dog, let's say a pug, for example, that gets exposed to kennel cough and gets ill, that dog is more likely to develop a bacterial pneumonia from that upper respiratory infection than, say, your long-nosed German Shepherd. So again, if you have a dog that has an underlying condition that would weaken its immune system, if they have a smushed face, if they haven't been vaccinated on a regular basis, you do want to minimize their exposure as much as possible. Now, just to recap for some of those who have joined us, it is frustrating, and I can imagine, it's frustrating as a pet owner, it's frustrating as a vet, to understand that we don't have nearly as much information as we want. And we're going to get to sort of a few more details about treatment here in a moment. But again, we don't know if this is new or novel, meaning this is a new organism that we haven't identified or seen yet that's emerged that we need to identify, or is this an organism that we're already aware of that has changed in some way that makes it more resistant to traditional therapy, or perhaps makes our vaccines less effective than they would otherwise need to be? We just don't know yet. But we're looking at this, most of the major veterinary centers around the country, as well as the CDC, are beginning to look at it. I did mention that, we're unsure at this moment whether it's viral, bacterial, or a combination of both. And of course, not knowing that means that when we have a patient in which we suspect this condition, we sort of, throw the kitchen sink at it at times to make sure we're not missing anything because of how rapidly this condition progresses. As I pointed out earlier, most of the common screening tools we would use, unfortunately, are coming up negative. And I'll tell you that with respect to the state veterinarian's investigation and the investigation taking place at many veterinary schools around the country, when we do have a patient in which we suspect this may be the case, we have to take samples from very deep within the nose and from the very back of the throat, some difficult to reach places, but only after we've been able to rule out some more common pathogens. Now, of course, then we come into the situation where we're having to deal with a sick pet. What do we do as far as treatment? Right now, our approach is a very aggressive one. Admittedly, some of the patients who are going to be exposed to these pathogens may not need that level of therapy. But I can tell you, as is the case with a lot of more severe respiratory conditions, first of all, from a diagnostic point of view, we're going to come in, we're probably going to want to do some blood work, mainly to see if we have a systemic inflammatory response. And possibly, although this hasn't been reported, are other organ systems affected? But perhaps more importantly, we're going to take some chest x-rays. We want to see what's going on in the lung tissue as much as possible. As I said at the outset, a lot of these patients are developing bacterial pneumonia, so bacterial infections of the lungs. We just don't know if the infection starts as a bacterial infection or starts as a viral infection, and then you get a secondary bacterial infection on top of that. And in veterinary medicine, at least, sometimes we find it very hard when looking at x-rays of the lungs to differentiate between lungs that are affected by a virus and a bacteria, especially in a case like this, when it can be so severe that affects the lung tissue en masse. So when we have that information, oftentimes we'll then take it one step further. We'll collect samples from the eyes, the nose, even the mouth, submit those for what Pam had referred to earlier for PCR testing. In some rare cases, we'll actually send them out to the laboratory and see if they can actually grow some type of organism from the sample that we took. Unfortunately, though, these tests take time. I mean, the turnaround time for a PCR test, can be a few days. The turnaround time, if we try to grow the bacterial or viral specimen in the laboratory, could be days to weeks. And unfortunately, we may not have enough time to wait for the answer before we decide on a course of action. So out of the gate, we're very aggressive. We're going to put this patient on very broad spectrum aggressive antibiotics. We'll tell you that based on our previous experience using a more unusual antibiotic called chloramphenicol at this point would be indicated, but we basically cover for any and all possible bacterial infection. Keep in mind also, and I haven't mentioned this yet, but because we live in Arizona, when we have patients with upper respiratory infections, oftentimes that can be due to something like valley fever. So we do have to test for that and exclude valley fever as a possible source of what we're seeing. Certain cases of valley fever admittedly can mirror what we see with this as yet, unnamed infection. So that is another sort of screening tool that we put the patient through. Getting back to treatment for the moment, we use aggressive antibiotics. We have to oftentimes support them in other ways, giving them intravenous fluids. Some patients will require care at a specialized facility that can provide 24-hour care where they can administer oxygen and perhaps, other medications to enhance or improve breathing. Again, it's all very much dependent on how severely the pet is affected, but it is quite possible. And I can tell you that we had to send several cases to 24-hour specialty facilities to nurse them through the worst part of the infection. And admittedly, as I said earlier, because of how long they're affected, once they were discharged, they still need to be treated with antibiotics and other types of medications to support them long enough that they can start eating and drinking again, maintaining themselves, and sort of get back to a normal routine.
A question, is there any approved antiviral medications that have been tried, or is there a thought in that at all?
There are some anecdotal reports of people using like Paxlovid, which is used to treat COVID. I haven't come across any reports even on some of the veterinary discussion boards of people using some more traditional antivirals that we find ourselves using with, let's say, for example, some more common viral infections in cats. I know there was one case report of a veterinarian, I think it was in Kentucky or Kansas, using Paxlovid, and somehow the dog got magically better. But there's unfortunately very little data at the moment and no widespread use of antivirals. The focus is providing more aggressive care for the bacterial component at the moment, if it exists.
Do you have an opinion on using a probiotic to build up their immune system?
Unfortunately, I mean, there's nothing wrong with using a probiotic, but I don't see at the moment with any evidence or anything to suggest that a probiotic would support the immune system in a way that would provide that individual with more protection against this particular infection. Not at the moment. I mean, whether this is a novel organism that's changed in some way, or this is a new infection that we're seeing, I would surmise that with how fast it moves and how it's affecting patients that typically are probably provided better veterinary care. I mean, most of these dogs are probably completely naive to it, meaning their bodies, their immune systems just don't recognize it and haven't developed the sort of fast reaction necessary to control it before it gets out of control.
Is there any pathology or necropsy data that's being done at any of the large veterinary centers to look at how this is affecting the lungs and potentially identify the organism?
So the Oregon State Veterinary Diagnostic Lab, based out of Oregon State University, is in the process of doing that because Oregon State has had the biggest sort of cluster of cases, on the order of at least several hundred reported cases. So that's in progress, but at the moment there's no consensus of opinion about the pathologic findings that would lead us in one direction or the other, viral, bacterial, or either. The other thing to consider is that it's a very frustrating thing because with the rate at which this is progressing, oftentimes we don't have a lot of time to wait for answers. We have to take our best shot at being very, very aggressive. And to be fair, for a lot of folks, if they have to make a financial decision, the cost of some of the more advanced testing is expensive, and they'd rather use that money to focus on treatment. unfortunately, I was going to say, the state of
have-
Arizona, unlike several other states, is not funding the testing for clients.
Okay. And then a question. So I don't know if you follow the Worms and Germs blog, Dr. Scott Reese out of Ontario. Yeah, his stuff. So like I was looking through his data. This is maybe getting a little bit off, but is there any thought in the US too about like this epidemiological curve of this? Because it looks like whatever this is has been trending potentially for a couple of years, that like the increase in sort of kennel cough infections has been sort of like rising despite our immunizations and other things. So is there a thought that this thing has probably been around for a while, but it's just sort of picking up steam?
So that's a really good question. It sort of does dovetail on the notion that the rate of vaccination against some of the more common pathogens that we've dealt with periodically has gone down over the last few years. Honestly, it's a good question. I don't have a good answer to it at the moment. It's not unprecedented in veterinary medicine to have new pathogens arrive. You've all had dogs that have been probably vaccinated against parvovirus. Well, parvovirus was virtually unheard of prior to the late 1970s, early 80s. It's not a disease that's been around for decades on end. The same thing to some degree with some viruses in cats. So this isn't unheard of. It's not unprecedented. But obviously in the world we live in, it's getting a lot more attention. As I said, interestingly enough, when you're sort of reading these case reports, again, we're talking about cases that have been reported. I know for a fact we saw several, close to several dozen cases. And I know a number of my neighbors saw the same numbers. It didn't make the news. So I guess getting to your point, is it new or novel? I don't know that it's so new or novel. There's a good chance it's been around. We just didn't recognize it nearly as much. For whatever reason, maybe it didn't just sort of mushroom into the bigger problem it is today. So I don't know. Excuse me, anyway, sort of getting back to treatment, we titrate the treatment to the patient at this point. Just so you know, the places that we're typically sending people these days, there's a facility in Mesa called Eureka. There's also a facility in, I guess you'd say North Phoenix, VetMed, that are probably the two best equipped at the moment to handle these types of cases because of the staffing they have around the clock 24/7 and the diagnostic tools and sort of specialty services they have readily available. Keep in mind, there were plenty of patients that we treated last year that didn't require hospitalization. They required prolonged treatment with antibiotics, cough suppressants, other supportive measures, but they didn't end up in the hospital. So, you're hearing about this condition, but it's not necessarily if you will, a death sentence for every patient that's exposed. Plenty of patients got through it just fine. But again, the key thing was, the patients that it's affecting are not the patients that are short on care. These are patients that are going to the veterinarian very regularly. They've got all their vaccines. Obviously, they're cared for by people who care enough to put them into a luxury resort, and yet they're still getting sick. And mind you, the age of the patient and the breed of the patient had no bearing on illness. We saw small breed dogs get it. We saw large breed dogs get it. We saw young dogs get it. We saw old dogs get it. It didn't make a difference. It didn't discriminate, in other words. So, I share everybody's frustration. I own a pug myself. I think about it every day since I oftentimes take him to work. Despite the fact that he's fully vaccinated, what might it do to him? That said, like I said, we have been here before, quite literally. Yes, this is a time of year when a lot of people travel. It's a time of year when a lot of people board their dogs, they get their dogs groomed, they go to daycare facilities because of that, the travel schedule. So it makes sense that we would perhaps see an uptick of cases around this time of year in 2023 or early 2024. Because last year, for no apparent reason, the cases just disappeared in January. We didn't see any. But it's something we're obviously going to have to stay vigilant about. On a slightly different note, you can certainly see a number of stories and sort of what I'm going to call fantastic reports about miracle cures that have popped up. as I said, somebody who gave a Paxlovid, the COVID antiviral, and magically cured their pet. And if I were you, I wouldn't pay too much attention to that. These are at best one-off cases, if that, and I strongly stress that they're probably either extraordinarily lucky or just coincidental. These pets probably would have gotten better anyway. So I didn't want to drone on too long because I'm sure there's other folks that have questions, but as I said at the outset, we have a lot more questions than the answers at the moment. And you as a pet owner, need to be vigilant. You know, if you start to see these respiratory signs, we want to look at them right away. B, recognize the fact that yes, it is portrayed as a sort of severe life-threatening disease, but truthfully, it doesn't have to be. If you can minimize contact or exposure with strange pets or stressful situations, because that is certainly a key component of something that we more classically refer to as kennel cough. It's the stress more than anything of being in a strange environment that would make a pet susceptible. By all means, do that. And should your pet come down with this and be treated successfully, obviously you want to, at that point, minimize your pet's exposure to other pets. And at this point, I have to say easily for several months. We just don't know how long the individuals are going to remain contagious, but we're going to put them through a course of treatment that could extend several months. And therefore, at least during the period when they're treated, I would not have them interact with other strange pets, out and about. I know people want to get their pets groomed. I know, the need for boarding and daycare is there. It's a decision you have to make judiciously. Thus far this year, we have not had any pets that have come in with this particular condition from, any facility. Last year, as I said, we were seeing it from, several different facilities, but there was no one single facility that was responsible. And every facility required a full suite of vaccines before the pets were allowed in. So they were obviously, doing everything they could to minimize the risk to patients, but yet it still occurred. The folks that we, oftentimes will, because they're across the street and they seemingly do a good job, we tell the folks, you go to D's, D Pet Hotel. I've spoken to the owners there, that they're, really upping their ante as far as how they're sanitizing the environment to minimize the risk to the pets they're caring for. But again, vigilance more than anything is what I would ask for. If you have concerns, obviously, let's get them in, give us a phone call and so forth. And truth be told, there may be times when we have to sit and wait a little bit. That's unfortunate. We don't want to throw the book at every patient that walks in the door. Not every patient may require that therapy or treatment. But we do have to watch closely. In those patients in which we are going to be most concerned, you will see a very rapid progression. That is both reported and from personal experience, I can tell you very true. These patients decline within 1 to 3 days very rapidly. And if you see that, I guess of anything, that's a really good indication that we, especially in an otherwise healthy dog, that we need to get attention for that pet ASAP.
Is there any known or understanding of the time from like infection to symptoms? Like in other words, the dog's in daycare, they're exposed. Like, is this a 7 day, 10 days? Like, do we have any idea of that incubation period?
We don't. I haven't seen anything published. I can tell you from personal experience, the incubation period appeared to be far shorter than the traditional, say, 7 to 14 days for Bordetella. Those dogs that we saw last year would oftentimes come home for a day, seemingly be normal, and within literally 1 to 3 days start showing some very severe symptoms. So the time course was much more rapid than what we're used to with some of the more common or traditional respiratory diseases. Other questions? I'll stop babbling. I'll give you guys a chance to ask questions.
Can I ask questions from a rescue perspective?
Sure.
We were taking in a number of, because you've seen them there, puppy mill dogs. And obviously they come in extremely stressed. Are they then therefore much more prone to picking something like this up? Because they come in max to the bit.
Sure. Anytime any patient who's stressed, who may not have been cared for properly, who may not have been on an appropriate nutritional plane, who may not have been completely vaccinated, yes, admittedly, they're going to be potentially more susceptible.
Okay.
But then again, they're going to be probably more susceptible to even some more run-of-the-mill respiratory diseases like Bordetella as well. So I guess if I was making a recommendation, finding a quiet, comfortable space without a lot of noise, ample food and water, even if you house, several pups together, which is fine, and trying to provide them the calmest possible environment. And then when appropriate, begin the process of vaccinating them to provide them immunity, at least against the things that we know are preventable, is reasonable. But the other thing, again, because of this rather short incubation period, if you bring these dogs in today, over the course of the next, say, 2 weeks, they don't manifest signs of this more severe respiratory illness, it's not likely something they came with. As I said,
Okay.
the time course of this seems to be much shorter than what we traditionally see with things like kennel cough, for example.
Thank you.
Hey, Josh, has there been any transmission from dog to human on this?
Not to our knowledge. No dog to human, no dog to cat. And since it may come up, we're not, we have no reason to believe at the moment that this is, human to dog. We did have during, COVID, there were documented cases where dogs and cats acquired COVID from their owners. Now, in the overwhelming majority of cases, and even in those cases we saw, truth be told, we couldn't tell the difference between that and just a mild cold, if you will. I mean, they all got better on their own without much intervention.
Okay.
But we have no evidence for that at the moment.
Okay, thanks.
Other questions anybody has?
You mentioned a little bit about sort of fomite situation. So like, I'm just thinking, because I have dogs in dog sports, so they, are in nose work, for instance. So like, even though again, they're requiring the dogs to be kenneled, no actual contact between the dogs. So if a dog is going and sniffing something like in barn hunt, like, they're sniffing in straw or their thing, I mean, so they're obviously their noses are touching these things, and then your dog is coming in, there's a nose touch to do that with, only a few minutes in between dogs. So, I mean, would that be considered high risk then?
I don't know if it'd be high risk. I mean, it's a higher risk, certainly. I mean, moist straw would be a much better environment for most of these things to lie in wait, if you will, than, a dried or stainless steel surface or a concrete surface or, even a grassy field, if you will. So, I mean, in theory, look, if somebody was asking me, hey, if you could postpone training for a month or two, I don't think that's unreasonable under the circumstances. You're just minimizing exposure to a whole variety of dogs. I don't want to draw too close a parallel, but we deal with a condition or disease in dogs, a bacterial infection called leptospirosis, which we had an outbreak of about 7 years ago. It's something that's transmitted in urine. Well, it's so readily transmissible that you can have a male dog walk over, lift its leg, urinate on something and aerosolize a little bit of urine. And any other dog literally walking through that cloud could come in contact with it. And as long as that urine remains wet, it's not dry, and even for a period afterward, that area is infectious. So, if this respiratory organism has any similar characteristics, yeah, potentially.
Thank you.
Other questions that come to mind? Anybody? Any answers? I could use those too. Trying to think.
Yeah.
Yes. So, okay. So thank you, Jessica. So airport relief areas would be, not the best place. I don't know that they ever get cleaned. So airport relief areas would be a great place to pick up diseases that are transmitted by stool, urine, respiratory secretions, pretty much everything you can possibly imagine. So yeah, I probably wouldn't use airport relief areas, or during the travel season, like rest stops, where they might have a defined area to keep your pets. In those areas outside, it's far less likely that you're going to be able to pick up a respiratory pathogen. But in a wet, confined, damp, humid, small room in an airport, yeah, that would be a very nice place to pick up something you'd rather not have your pet exposed to. I wouldn't want to walk into one of those airport relief areas. I have a few times. So, and that's with shoes and, so. Other questions anybody has? No. So one of the last things to say is this is obviously, emerging, and I think it's also probably fair to say, if this follows the same pattern and we begin to see the number of cases are concerned tail off after the holidays, there's still a good chance we may not have an answer until much later in 2024. much of the testing that's being done, especially if this is a new organism, is require the effort of a lot of folks to study the organism or organisms, understand how they actually cause disease. And then of course we have to be sort of the infectious disease experts in veterinary medicine and have to determine the best course of action, both from a standpoint of prevention as well as treatment. And that takes time. So, this last year, we're having it now. It's not unreasonable to think that it could happen again, but if it does, hopefully we have a lot more information to provide you with about how to both recognize it, prevent it, and then better guidance on as to how we might treat it if it occurred.
So, to kind of summarize your recommendations and right, because it's a bit of a challenge when you have a dog. They have a short life expectancy. You don't want to take away all the things that they enjoy because that's part of quality of life. So, kind of what I'm hearing is like really minimize that nose to nose contact, good hygiene. So like I said, when I go to my dog sport, I wipe the kennel out with, Prevail or Viricon. So like, just trying to be as sanitary as possible and then avoiding the high risk areas like the dog parks and things like that. And try to risk minimize, but still allowing your dog to have quality of life.
Right. And I would say that, if you do observe or, a cough, especially when it's very rapidly progressive, that's a big red flag. You need to be assessed immediately. And, we're obviously going to have a better chance at addressing the condition should it occur if we know right away, especially with the very fast rate at which this disease advances. But yes, the way you summed it up, I think is a very realistic perspective to have. And I think that really, as I said, after the holidays pass and fewer people are traveling, fewer people are boarding, fewer people are daycare, perhaps even fewer people are grooming their pets. As we did last year, these cases all but went away. And we don't know what will happen, but I wouldn't be surprised if it followed the same pattern. So if you're looking to pull back from, those more social activities, I don't think it's for an indefinite period. I think that once we get to the holidays again, we're probably going to see a decline, and admittedly, it's going to disappear from the national media. And just we as veterinarians will be working on finding a solution for when it flares up the next time. So, you're welcome. Other questions anybody have?
Water bowls?
I'm sorry?
Water bowls?
Honestly, communal water bowls, I would probably shy away from. Yeah.
Cool. Thank you.
They walk up, they sneeze, they have snot draining out of their nose. And the next dog comes along and puts their nose right in that patch, that wet spot. Yeah, not a great idea. Not at the moment.
Thank you.
You're welcome. Other questions?
Do you have any suggestions if you are traveling with pets, like flying with pets? Because yes, the pet relief areas are not sanitary at all on any day. So do you have any recommendations maybe for that we can keep in mind?
Well, I'll tell you the undesirable things that I've done. Last time I traveled with my puppy, I brought like the puppy pee pads.
Okay.
And I just went into a family bathroom, laid them down, let them go on the puppy pads, clean them up, throw them away. Obviously, it's not as easy to leave the airport or the secured area and take them outside. But for me, I would take them into the family bathroom and use a pee pad. You're going to get far less dog traffic through that area. And hopefully it gets cleaned more regularly than the dog relief area does. That's kind of what I'd probably look towards doing.
Would a dog diaper work, or will some dogs not urinate?
Some may not. Not every dog is going to use a pee pad, but and maybe this sounds terrible, I don't know, but the bathrooms are constructed so that if there was a major spill or issue, they're very easily cleaned. You can sort of flush water down the drain in the center of the bathroom. So should that be necessary, if they urinate on the floor, you could fairly easily do that. So that's another advantage. Yeah. Jessica, does that kind of answer the question?
Yes, thank you.
Okay. Oh, Ashley, sorry.
How many cases have been reported in the US?
Well, that's interesting. So they number in the hundreds, but again, that's reported cases. I can tell you, last year, our hospital alone could have accounted for 12 to 15. And if most of the other hospitals, at least in say the Scottsdale area, were seeing the same thing, then we would have very easily seen that number of cases just in Scottsdale alone. So I think the number of reported cases is a bit of a misnomer. I'm sure many of the cases don't get reported. So it's probably, the number is probably a lot higher. And remember, they have to get recognized too. And the process of recognizing a dog as having this particular condition means excluding some of the things that we're aware of and can test for. And not everybody wants to go down that route. So I think at the end of the day, the number is probably a lot higher than what's been reported. Other questions that come to mind? No? Wow. I was prepared for more. Now I have to go back and deal with my kids' homework. So I was really hoping for more questions. Oh, sorry, Cindy, did you have a question?
No, I'm fine. I was just laughing at your kids' homework.
Well, all right.
One other question, what should we
Sure.
expect, like, in terms of, you mentioned a little bit earlier, some changes in like how you're dealing with it from a practice situation. So just to educate us, like, are you needing to gown, glove, like what kinds of things are you doing to prevent like transmission in the clinic situation?
So whenever we have a patient that calls up, and the staff up front knows the things to listen for or look for, we have one exam room in the hospital. And I'll be honest with you, it's typically the room that's used to perform euthanasias. We don't really use it for anything else. So we try to isolate it. It's also the shortest distance between the front door of the hospital. So we're able to basically isolate that patient in that room for anything we want to do, even things that we would normally take that patient back for. It's got a separate venting system, so it doesn't circulate air internally in the hospital. And then we have a defined protocol that really takes closer to 4 hours to complete, of completely sanitizing the room from the top of the wall all the way down to the floor, actually several times, to eliminate the possibility that there be any type of fomite transmission. And then we have everything in the way of gloves, goggles, plastic gowns, everything other, protective gear, glove, that we would need to use to minimize exposure. And then the staff always, when we have a situation, they change their clothes too. So, and then of course everything gets bleached. The whole place smells like a public pool because there's so much chemicals and bleach floating around. So yeah.
Would it be a foregone conclusion that if one of your dogs in your house got it, that the other one would probably, that you should watch them for it?
Yeah, unfortunately, it's probably a safe assumption. It is, it's not a foregone conclusion, but it's a safe assumption. The fact that we're seeing well cared for pets affected by it, pets who have all their vaccines, who are otherwise in pretty good health, and whether it's novel or new, if it's novel, then the immunity provided by the vaccines we currently use isn't sufficient. If it's new, then most of the pets are completely naive to it. So yeah, I think it's reasonable to assume that if one gets it, they all could be exposed. And we actually had that as a situation. I remember one family in particular that had 3 standard poodles, all of which were boarded, all 3, like dominoes, were affected. One passed. One we had to hospitalize as a specialty facility, and then the third we were able to treat just as an outpatient.
Oh.
Now again, they were all housed in this facility at the same time, and I don't know whether they all got it at the same time or it passed from one to the other. So
I have kind of a quick 3-part question. One, if water bowls are a no, then communal toys are probably the same.
yeah.
Okay,
Yeah.
then do you know what shelters are or are able to do right now with their dogs? So that isn't like they're able to see it, so they're gonna know in 1 to 2 days, oh, this dog is sick. Are they like holding back on adoptions, or are they, what are they doing?
That's a very good question. Most of the larger shelters in the valley have, I guess, the equivalent of an infectious disease ward protocols in place to minimize exposure to the other pets. But look, it happens all the time under normal circumstances that we see a pet that gets adopted from a shelter that ends up developing, kennel cough,
Right.
7-9 days later. So it's well within the realm of possibility that you can adopt a dog who does not show any symptoms yet, and 2 days later comes down with something.
Okay.
It's a tough situation to be in because there's only so much you can do to minimize contact, and you are dealing with an inherently stressful environment
Right.
with pets who have a whole sort of varied list of backgrounds as far as veterinary care is concerned.
Right. Okay, thanks.
So
So
based on
Josh-
that, if you're bringing a new dog, like a rescue dog, into your home, would you then recommend, potentially keeping those animals separate for like about a week, then like 7 to 10
Right,
days
yeah.
to be safe?
Yeah, I mean, I think a 7 to 10 day quarantine period is reasonable. 10-day quarantine period is reasonable. I mean, in theory, on day say 9 or 10, they could come down with something, but based on what we've observed so far, if it's this bad disease, it's going to show up before that point. If it's not until days 9, 10, 11, whatever, that they're getting sick, it probably isn't this condition. It could be kennel cough, hell, it could be valley fever, but it's probably not this particular condition.
And obviously that would apply to fosters as well.
Yes. Yeah. Any pet you're bringing in. I mean, look, it even applies to, maybe your neighbor's dog.
Right.
Who may go to boarding or grooming or whatever and may have been exposed. And they're fine one day, they get dropped off at your home, and then 2 days later, they're seriously ill. And guess what? Your dog is now exposed to the same thing they were exposed to. So
right.
That's a possible scenario as well.
Do you know if any dogs are symptomatic for longer than the 1 to 2 days and out there just spreading it around?
So we don't know exactly what the incubation period is. So we don't know how much
Right.
time elapses between the time they're exposed and the time they show up with symptoms.
Okay.
Like I said, I can say anecdotally that those dogs that we've seen within just a few days seemingly
Okay.
very, very ill. So there's a little bit of an uncertainty. I don't have a great answer for that question. just
Right,
because I
right.
don't know.
That's cool. Thank you.
Josh, for the hotel wise, I know you talked to Tony and we've been amping up everything for like a year and a half. The bowls, we've been obviously changing them every hour on the hour, making sure they're clean. Is there anything else we could do in that regard?
Yeah, I mean, I guess if it were me, I would buy, go to Costco and buy disposable little sort of, plastic dishes or something you might get like a hot dog in at like a snack bar, like individualized dishes that you can just discard rather than having to sanitize umpteen stainless steel bowls. They're single use, they're cheap, they're inexpensive. And the other thing I guess I might consider is rather than offering water from a communal source, maybe just rotating the pets in and out a little bit more often, giving them a chance to eat and drink in their own sort of kennel or run, so there's no mixing of bowls or food.
Okay.
I mean, it's a tough situation when you're in your situation, when you're housing animals, when you're boarding and you have animals coming in for daycare. It's tough because there's going to be a lot of exposure. But certainly a single-use bowl or taking them back to their housing would probably be a better option.
Okay.
I'm sorry, Chastity.
Oh, no, you're good.
Okay, I was just gonna mention, I'm a walker. So what I've been doing is sanitizing bowls. I didn't have enough to buy more bowls. So I've been sanitizing each bowl between clients. But you might want to spread the word to clients who have walkers and sitters and whatnot that maybe, here are some disposable bowls, please use these. Let them know because they may not know.
That's a good point. You can buy them off Amazon. I mean, they're just, I don't know. I haven't been to a hot dog snack bar recently, but these little sort of like paper, but wax lined paper trays that are cheap and disposable. Hold a couple of cups of water.
You just use Dixie cups.
Yeah.
Just use Dixie cups.
10 minutes.
Yeah, that would work. Something like that. Absolutely.
Sure. They're cheap.
Yeah.
Thank you for that.
You're welcome. And, if we get more information, by the way, we'll, put that out through our sort of email server and share that with everybody. But like I said, if you have other questions, you can certainly, give us a call. All the other doctors are sort of looped in and obviously are dealing with this and aware of this. And at least two of the other doctors, Troop and Dr. Brown, they went through this last year too. So they have some firsthand experience. So, well, I'm sure everybody has high school homework to do at the moment. Thank you, everybody, for joining. Like I said, if you have other questions, feel free to shoot them over. We're recording this, so thank you for not cursing. I did my very best not to. And we're not going to post it on social media so that if people want to reference it, they can do that as well.
Thank
Awesome.
you very much.
Thank you.
Thank you, Josh.
Oh, I'm sorry.
Thank you,
One more
Josh.
question. It says, is it safe to go to your groomer with older dogs with kidney disease? In our situation, like with the groomer, we never allow contact between pets. And, because we're a veterinary hospital, I think we do a pretty decent job of sanitizing frequently, throughout the course of the day. And we require the pets to be vaccinated anyway. So yes, is there a small risk of transmission? There is, but it would be greater if, your dog was mixing with 5 or 6 others with an unknown history. But in theory, sure. Yes.
So are you saying right now, as like a definitive preventative, would it be wise to instruct clients to just not go to the groomer or other places like daycare, whatever, because those people rely on that money? So the groomers are going to be like,
Yeah, there's not a perfect solution here.
I know, but for like how long, so that the groomers might have an idea.
Right, from a let's say an epidemiologic standpoint,
right?
You minimize the chance of exposing your dog by minimizing minimizing their exposure to other dogs at the moment.
Right.
So yes, in theory, yes.
Okay. Ouch.
So, other questions? I don't want Zoom to cut me off. I forgot what I budgeted for this, so I don't want to cut us off prematurely. But all right, well, thank you everybody again. If you have any other questions, hit us up.
Thank you.
Thank you, Doctor.
Thanks, Josh.
You're welcome. Take care, everyone.